So a hernia is a hole or a defect in the layers of the muscular abdominal wall. So the abdominal wall has 3 layers of muscle, thin layers, and when a defect or a hole occurs, a hernia will arise. And when you strain or cough or heavy lift, the internal contents of the abdomen will come through that hernial hole, and you'll see a lump over the skin. So there are 3 common types of hernia, ones that occur in the groin, ones that occur in the umbilicus or belly button area, and ones that occur through previous operating scars. For instance, if you've had your gallbladder removed, or operation on your intestines, or a cesarean section. They're the 3 commonest areas where hernias will occur. So hernias don't always need an operation, but they do tend to get bigger in time and become more painful. If that pain is affecting your everyday life, or if there's a risk of the bowel actually getting caught and strangulated in that hole, then it's worth having an operation. And there are 2 types of hernia operations. For the common one, for the groin operation. So the treatment options for hernias are either do nothing and just watch and wait and see what happens, or do an operation. If the hernia isn't causing any symptoms, it's not causing any pain, and there's no risk of it strangulating, then it's perfectly reasonable to just watch and wait. However, they do tend to get bigger in time and become more painful, and most people end up having an operation for a hernia. There is a recurrence rate after any hernia repair. For the common groin operation, there's about a 2 or 3% chance it might come back. That chance is higher if the hernia is bigger, or if the person is suffering with overweight, or if they do a lot of heavy lifting afterwards. For incisional hernias, there can be up to a 20% chance of it coming back. The only thing you can really do to prevent a hernia recurring in the first place is to try and avoid lifting really heavy weights. If you go to the gym and you're a bodybuilder, there's a family history of hernias, then you may be at risk. If you have a heavy lifting job, you may be more at risk. So avoiding heavy lifting is the only way of decreasing your chance of getting a hernia. So the recovery period for a laparoscopic or keyhole surgery operation, where there's less cuts in, faster recovery and less pain, usually about 7 to 10 days away from the office, but some self-employed people are back in the office and working after 2 or 3 days.